ACL injuries can be really scary, but does every tear necessarily mean that we need to have surgery? Today I'll be talking to a knee surgeon and a physiotherapist to find out exactly that. So someone comes in with an ACL tear. Is surgery always going to be the immediate thing that we need to do?
No, not all patients with an ACL tear need surgery, but most do. The ACL, as we previously mentioned, is really important in rotatory stability. So if you wanted to avoid surgery, you would have to live your life in a straight line and avoid any pivoting activities. If you want to get back into any sort of high-level sport or any activities that require twisting and turning, even if that's recreational skiing, for example, you're likely to need your ACL.
So what factors would you say would influence that decision for you to want to do surgery?
It's the patient's demands on their knees, the sports that they want to play in the future, and the hobbies that they want to take on. As well as that, there are some things that make surgery more likely, such as existing damage to the shock absorbers or an inability to straighten the knee as part of the injury.
So say surgery isn't part of the plan for the individual.
Yeah.
How long would that recovery journey then look like?
The simple answer is it depends on what your goals are. Yeah. So in a lot of ways, it's very similar recovery timescales to having had the surgery. So if we're thinking about a return to sport, it's still going to be 9 to 12 months, dependent on the sport you play. If we're thinking of more basic things like, well, when will I drive again? When will I be back in work? Driving's about 6 weeks. Dependent. Work depends on the line of work, could be anything from 6 weeks to 3 to 4 months. But there's so many variabilities in that. What are your problems? If you've got good stability, although there's an ACL injury, good stability, good strength, you might be able to do some of those things far more quickly. It might take a little bit longer. I think it's always key early on to know you're going to have to be patient with it. And be consistent with what you're doing. But yeah, it is a long recovery. There's no easy way of saying it. It's a long recovery.
So hearing you talk about the rehab journey, the timings with surgery and if we're just in rehab seem quite similar. So surgery isn't always going to be a quick fix, but is it necessary?
No. Look, most people will have surgery. Yeah. The way things are at the moment, if you have an ACL tear, most people will end up having an ACL reconstruction. There is evidence to suggest that with good rehab, the outcomes are similar whether you do or you don't, but the vast majority of people, whether it's athletes or Joe Public, most people will have an ACL reconstruction.
So when does surgery become inevitable?
Early on after your injury, if you're really struggling to straighten your knee, that's called a locked knee, that's a scenario where you want to have surgery early. So I would say that's inevitable. Another scenario would be if you've tried to go down the route of non-operative management, so no surgery and rehabilitation alone, and your knee's still giving way and you're not able to do the activities you want to do, I would say that also means we need to do something to stabilize the knee and making surgery inevitable.
As a personal trainer, I know with a lot of my clients and members that I see in the gym, that they're not always the best at doing everything that needs to be done after surgery. Would you say that rehab is always a necessity post-surgery?
Yes. Surgery is only 50% of the journey. It takes a year to recover from ACL reconstruction. There are lots of different phases of rehabilitation, but at every stage you need to be guided by an experienced professional, physiotherapist, or a personal trainer who can take you through the next step of physiotherapy. Physiotherapy and rehabilitation is a must after surgery.
Hopefully you found that as helpful as I did. For more information on ACL injuries and treatments, watch our next video.